Dr. Ahluwalia is with us. Let us begin with the topic that so many people are talking about.
Measles, immunizations. Do we need the shot again? How long? I mean, there's just so much. So I don't even know where to start with you. Let's just go.
Here's an interesting statistic. In 2000, the U.S., we announced that we had eliminated measles.
Eradicated.
Well, eliminated.
Okay,
not
eliminated.
Eliminated means there's no local transmitted cases. Everything that happens comes from outside. There's still cases, but they're imported from out of the country. And last year we had 630 cases, which is the most we've had for a long time.
And this year we assume it'll be way more than that.
Yeah. So and what really brought it to the fore were these people who got infected at Disneyland. So the schedule is that a child gets the measles vaccine between 12 and 15 months, the MMR, and then at 4 to 6 years, you get a booster.
So it's just the 2 shots.
Just the 2 shots. And so inherently, kids who are less than 12 months old, a year old, are going to be susceptible to the measles virus. The reason to get 2 shots is the first shot makes you about 93 to 95% immune, which is great. And then the second shot takes it up to about 97%. Now, the people who got infected at Disneyland, some of them had been vaccinated.
So do we need to go get, like, do I need a shot again?
But wait. So they were. The first shots?
1 or 2, but
okay.
There's documentation that they were vaccinated. So the question is, why did they get measles? So when we say that 97% of people who are vaccinated are immune, that means that there's about 3 to 5% who aren't. And these are people who either just don't develop the immunity. If they develop the immunity, it's not as much as other people to make sure that they don't get the virus. But what's important is, even if you get vaccinated and you have the measles, it is much milder than you would without it.
Okay.
There's another side to this, and maybe I'm wrong, but if there are 3% for whom it doesn't work, you add that 3% to the 8 or 9 or 10 or 11% who are not getting vaccinated, and you've crossed that line.
Exactly. So we've talked in the past about this concept of herd immunity. So 90 to 95% of people in a population need to be vaccinated so that the virus can't jump from person to person. We seem to have lost that herd immunity for reasons that people have made decisions not to have the vaccination.
And what would you say to those who have chosen not to or are on the fence about it?
There is no scientific evidence that proves that vaccines cause autism.
And I'll give you the response you're getting from some people. Easy for you to say it's not your child.
Agreed.
Right? That's what they say.
Yes, agreed. But, we can make up anything we want. At the end of the day, we have to have some scientific literature to prove or not prove that.
Some of the doctors, for instance, Jay Gordon, who is well known here for being a guy on the fence about it, he's kind of backed off a little bit.
It feels like he's backed off a little bit, right?
Yeah. So I think that everybody understands that there is no evidence. And when you make a decision for your child, you're making a decision for the community.
Do adults need a booster?
No. Unless you're immunocompromised or there's some other reason too.
All right, so you stay firm. Get the shots.
Get the shots.
Get the shots. Don't delay them. Some people delay them because they think it overloads a young child's system.
Well, that's a choice to make, and that's fine. If you decide you don't want all the shots at the same time, but at least
spread them out, but get them.
Get the shots.
Another thing relating to our kids, so much with these food allergies, they have nuts, they have peanuts, they have any type of food allergy out there. Now we're finding out maybe they're not as allergic as we thought.
I think we're overdiagnosing food allergies in our kids. And the concern is that a lot of these decisions are being either made by parents themselves, because they either read some things or they get these home kits that you can give to your kids and test, which are not accurate at all. And the other thing is, even, so when you feel that your child has an allergy versus a sensitivity. So an allergy is you develop a rash, you have hives, you have difficulty breathing, you can have an anaphylactic.
Yeah,
all of those are allergies. The sensitivity is, you have bloating or you have gas or, all of those.
So one is an immune system response,
Correct.
the other is something else.
Yes, the other lack of an enzyme or the inability to digest or something like that. And so they're completely different. And we need to make sure that we understand the difference between the two. One, you obviously don't want to give your child something if his throat is going to close. But the other is you're preventing them from getting nutrition if they're lacking an enzyme that you can substitute.
How do we know the difference?
So you go to a doctor. Blood tests are not proof. So just because you have a positive blood test doesn't mean you have the allergy. You have to have something called a food challenge, where the doctor will give the child a little bit of the food and watch what happens. That's the proof in the pudding, right?
Not just a
and
blood
it'll happen
test.
soon enough there
Yes,
to be
exactly.
clinically...
To pull out the
If you're going to have an
EpiPen if you
allergy,
need it,
it'll happen
yeah.
pretty quickly. So please make sure that you're not preventing your child from getting the nutrition they need, because you've
Next
read...
time you come in, we'll
Yes.
Got to talk
discuss...
about the.
No, we'll
No?
discuss why so many kids are allergic to peanuts. When I was a kid,
I had
nobody was ever
yeah.
allergic
Yes,
to
there's
peanuts.
this whole theory about
Okay,
why. Yes.
next time you come in, that'll be
Yes,
good to talk
for sure.
about. Thank you very much.